Hi, welcome to Checking In at SEA. My name is Perry Cooper. We are here in the Central Auditorium, which is just above the Central Checkpoint here at SEA in our main terminal. We are here for the pilot program start of COVID testing. And with me is Dr. Ann Jarris, who is with Discovery Health MD. We are here to talk about the program and answer some questions that you may have right off the bat. To start with, can you give us an idea of what this is all about and kind of how it came about?
Well, thank you. We are thrilled to be here. We are offering COVID testing for travelers. This is non-medically necessary testing for anybody who needs to test to meet a state mandate or a country mandate to have a negative PCR test in order to enter.
And that's a big key for this as well too. We're not talking about people who actually have symptoms or who have maybe contact traced, correct?
Correct. If you are sick, if you have any symptoms consistent with COVID, like fever, shortness of breath, cough, loss of smell or taste, you should test through your doctor or through one of the City Seattle sites designed for symptomatic testing. Or if you've had a close contact exposure to a confirmed case in the previous 14 days, you should test through your doctor or one of the other sites.
And a good example for what we're talking about, this is really leisure travel. Our biggest example here on the West Coast is going to Hawaii, which has recently started a program where if you can get tested, a negative test within 3 days, you can avoid their 14-day quarantine. So how does that work then with this testing?
So we are a trusted testing partner with the state of Hawaii. If you need to have a negative test to bypass the quarantine, what you would do is go to our website, discoveryhealthmd.com. You would sign up to book a test. You choose the date and time that works best for you. We offer same-day testing before 9:15 a.m. on Monday through Friday, or next day results 7 days a week. After you book the test, you will be directed to register on our platform, and this is a very important step that needs to be done before you show up. We will ask you some demographic questions. And then once you're here, our administrative personnel will sign you in, confirm your identity with your ID, and take you over to our clinical personnel who will obtain a sample.
Now, does that mean you can't do walk-ups, or it's just the encouragement? You would rather have everything done online before you get here?
If you walk up, you can go online to see if there's a slot available. We do have a lot of capacity. We are able to scale up very quickly. So it's most likely if you walk up, you'll be able to find a slot online that you can book. But we ask that you go through the online process before you come into the room.
Okay, and then I think it's good to re-emphasize to us as well too, this is something that you need to be planning about ahead of time. This is something you've got to do 72 hours before your travel. This is not something that you can just walk in and do ahead of your travel that day. So keep that in mind, like we always talk about here at SEA. When you're planning your travel, you need to think about those steps. This will just be another one of those if you need to do this a day or two before you actually head out to travel. So overall, what is the cost of the test, and then how does this work from an insurance standpoint?
The cost of the test is $250, and that includes the lab fee and all processing fees and access to our online platform. This is consistent with the pricing at airports in Alaska and in California. Every state and every insurance company has its own rules, but we have confirmed with the Washington State Office of the Insurance Commissioner that non-medically necessary testing will likely not be covered by your insurance. So that is, this is something that needs to be self-pay.
Okay, and again, remember, think about those types of things before you do this process, and make sure that you understand the restrictions of the place that you're going to and how this may or may not work from your standpoint, and just from a timing situation as well too. So walk me through a little bit about what they'll go through once they then get here. After all the registration online, what happens here?
So fortunately, we are using a kinder, gentler sampling technique. Many people are familiar with the deep nasopharyngeal swabs that can be uncomfortable. We're using an observed anterior nasal swab, where a trained medical clinician will watch you obtain a sample, putting a Q-tip about 1 inch up your nose. It's very comfortable, it's very well tolerated, and we've been using this type of testing since April in the maritime industry with excellent results.
Okay, and after the test happens, what's the next step? Do you alert people, or how do people understand what happened?
So the next step to get your results would be to log on to our platform, and you'll be able to download your results in formats that have been approved by the state of Hawaii.
What happens if it's a positive test?
If it's a positive test, you're going to get a phone call from one of our clinical staff who will break the bad news. They'll give you instructions on how to isolate and how to do contact tracing to find people who need to quarantine.
Okay. And then just from a standpoint of as people arrive here, one of the things that we want to kind of emphasize as well too is that this is most likely not for folks that are transitioning through the airport. Again, from a timing standpoint, if you're connecting from somewhere else going through SeaTac, this is probably not going to work, right?
Well, in an ideal world, we'd have rapid testing available, and we are working towards that. As the supply chain improves, we will start to integrate that over the next couple months. Right now, the best we can offer is same-day results if you're flying in the morning. So if your layover is long enough, that is a possibility. Otherwise, it's best for you to plan ahead. Ideally, you would test 48 to 72 hours before your departure.
Okay. Is there anything else that we haven't touched on that you might want to add?
The most important thing here to remember is that no testing strategy replaces a 14-day quarantine. The state of Hawaii is taking a measured risk by doing this, and they are reducing their risk through testing. But you as a traveler are responsible in the 14 days before you travel for being absolutely diligent about good masking, social distancing, and hand and cough hygiene.
Okay, and last reminder, where do people go to get more information?
You can go to our website, discoveryhealthmd.com.
Okay, excellent. So hopefully that answers a lot of your questions. More information, as you mentioned. We appreciate you checking in with SEA.